Hello and welcome to another episode of the Irish Hematology Oncology podcast, a podcast where we aim for it to be like grabbing a coffee with a trusted colleague to discuss the latest in cancer care, break down complex topics and share practical experiences. I'm Eoin Tabb, your host and a pharmacist based here in University Hospital Waterford. Today we're diving into a topic that's essential for anyone working in cancer care, and that's infusion-related reactions, or IRRs for short. So whether you're a nurse prepping a patient for chemotherapy, a doctor overseeing immunotherapy treatments, or a fellow pharmacist like myself, understanding IRRs is absolutely crucial to ensuring the best possible care for our patients. So what exactly are IRRs? Let's break it down. Imagine your immune system as a loyal guard dog. It's always on the lookout, protecting you from harmful invaders like infections. But sometimes this guard dog can get a little overzealous and mistake a friendly visitor for a threat. That's essentially what happens with an IRR. Certain cancer treatments, especially those newer targeted therapies like monoclonal antibodies, are a bit like unfamiliar faces to your immune system. They're big, complex molecules that your body hasn't encountered before. In some cases, the immune system reacts as if these treatments are dangerous, triggering a cascade of events that we call an infusion-related reaction. It's important to note that IRRs are not your typical side effects. Think of those expected, often dose-dependent reactions we see with many cancer treatments like nausea, hair loss, or fatigue. These side effects are usually related to how the drug works against cancer cells. IRRs, on the other hand, are more like unpredictable allergies. One patient might sail through treatment without a hitch, while another receiving the same medication could experience a reaction. Now, here's the tricky part. IRRs can vary wildly in their presentation. Some might be as mild as a bit of a rash or a slightly elevated temperature. Others can be far more serious, involving difficulty breathing, a plummeting blood pressure, or even in rare cases, life-threatening complications. This wide range of potential reactions is why it's so crucial for us all in cancer care to be well-versed in IRRs. By the end of this podcast, we aim to equip you with a solid understanding of what IRRs are, how we classify them based on severity, and most importantly, the steps to take should a reaction occur. Whether you're new to cancer care or a seasoned pro, a refresher on IRRs can only enhance your ability to provide safe and effective care to your patients. Okay, so let's kick on and see with our first segment on understanding the basics of IRRs. So let's delve deeper into the intricacies of infusion-related reactions. When we administer certain cancer treatments, particularly those cutting-edge monoclonal antibodies that have revolutionized cancer care, the immune system can sometimes respond unexpectedly. Think of it as a symphony orchestra where one instrument suddenly decides to play a completely different tune. These monoclonal antibodies are large, complex molecules often designed to target specific proteins on cancer cells. While they can be remarkably effective, their novelty can also trigger the immune system to sound the alarm. It's as if the body sees these new molecules as potential invaders, prompting a defensive reaction. This reaction can manifest in a variety of ways, from mild discomfort to severe, life-threatening symptoms. Part of this immune response is a surge in the production of cytokines. These are tiny messenger molecules that act as the communication network of the immune system, orchestrating a complex dance of cellular responses. In the case of IRRs, there can be a massive release of cytokines, creating a so-called cytokine storm. This storm is essentially a state of hyperinflammation where the immune system goes into overdrive, leading to the diverse range of symptoms we associate with IRRs. Now, it's important to distinguish IRRs from the more predictable side effects commonly associated with cancer treatments. We all know that systemic anti-cancer treatments can often cause nausea, vomiting, hair loss, or fatigue, to name but a few. These side effects are usually related to the mechanism of action of the drug. That's how it works to kill cancer cells. IRRs, however, are a different beast altogether. They are not directly related to the drug's anti-cancer activity. Instead, they are a consequence of the immune system's response to the drug itself, or to other components in the infusion solution. This is why IRRs can be so unpredictable, varying greatly from patient to patient and even from one infusion to the next. The timing of IRRs can also be quite diverse. Some reactions occur immediately or within a few hours of the infusion starting. These are known as immediate hypersensitivity reactions. Others may not manifest until days or even weeks later, making them even more challenging to diagnose and manage. Furthermore, the symptoms of IRRs can mimic those of other illnesses, such as infections or allergic reactions, adding another layer of complexity to the whole picture. To help us navigate this complex landscape, healthcare professionals rely on a standardized grading system called the Common Terminology Criteria for Adverse Events, or CTCAE, and you'll hear us talk about this throughout the whole podcast series. This system provides a consistent way to classify the severity of IRRs using a scale from 1 to 5. Grade 1 represents mild reactions, while Grade 5 indicates a fatal outcome. By assigning a CTCAE grade to an IRR, we can quickly assess the severity of the situation and tailor our response accordingly. It's a bit like a triage system, helping to prioritize patients and allocate resources effectively. We'll delve deeper into the specific grades and their corresponding symptoms in the next segment. Okay, so on to our next segment, grading the severity of IRRs, a roadmap for response. As we've discussed, infusion-related reactions can manifest in a wide range of ways, from mild discomfort to life-threatening emergencies. That's why having a standardized way to assess the severity of an IRR is so crucial. It allows us to quickly determine the appropriate course of action, ensuring the best possible outcome for our patients. The Common Terminology Criteria for Adverse Events, that CTCAE that we're saying, is gold standard for grading IRRs. It's a 5-point scale ranging from Grade 1 mild to Grade 5 fatal that provides a common language for healthcare professionals to describe and communicate the severity of reaction. Let's take a closer look at each grade and what it means for patient care. So Grade 1, mild reactions. Imagine a patient who, during their infusion, develops a slight rash, feels a bit warm, or experiences mild itching. These are typical examples of Grade 1 IRRs. While these reactions might be a nuisance, they're generally not cause for major alarm. The infusion might be slowed down temporarily, or the patient might be given an oral antihistamine to alleviate the symptoms. Close monitoring is essential, as a Grade 1 reaction could potentially escalate. However, in most cases, these mild reactions quickly resolve and without significant intervention. Then you have Grade 2. These are moderate reactions. If the patient's symptoms become more pronounced, we move into Grade 2 territory. This might include a rash that spreads, a fever with chills, or a noticeable drop in blood pressure. In this scenario, the infusion is typically stopped and the patient is given more potent medications such as an intravenous antihistamine or corticosteroids to manage the reaction. Close observation is crucial, as Grade 2 reactions can sometimes progress to more severe forms. Once the patient stabilizes, the infusion might be resumed at a slower rate, but this decision is made on a case-by-case basis. Grade 3, severe reactions. This is where things become critical. A Grade 3 IRR signifies a severe reaction that requires immediate attention. Patients might experience difficulty breathing, a widespread and intensely itchy rash, a significant drop in blood pressure, or even altered mental status. In this scenario, the infusion is halted immediately and additional medical personnel are called in to assist. The patient might require oxygen therapy, intravenous fluids, or other supportive measures to stabilize their condition. Grade 3 reactions can be frightening for both patients and healthcare providers, but with prompt and appropriate intervention, they can often be managed effectively. And then we have Grade 4, life-threatening reactions. Grade 4 is the most severe category of IRRs, representing a life-threatening emergency. This could include anaphylaxis, which is a severe allergic reaction, seizures, or other critical complications. In this situation, every second counts. The infusion is stopped, emergency medications like adrenaline are administered, and the patient may require immediate transfer to a higher level of care. The goal is to stabilize the patient as quickly as possible and address any underlying complications that may have arisen. And then you have Grade 5, fatal reactions. So sadly, in some rare cases, IRRs can be fatal. This is a stark reminder of the potential seriousness of these reactions and underscores the importance of vigilance and prompt intervention. By understanding the CTCAE grading system, you'll be equipped to assess the severity of an IRR accurately and respond accordingly. It's a valuable tool that can help guide decision-making, improve communication between healthcare professionals, and ultimately ensure the best possible outcomes for patients experiencing these reactions. Remember, in the world of IRRs, every second counts, and a swift, well-informed team and response can make all the difference. So now we go on to our next segment, mastering IRR management, prevention and intervention strategies. In the realm of infusion-related reactions, the old adage, prevention is better than cure, rings especially true. While we can't completely eliminate the risk of IRRs, we can significantly reduce their likelihood and severity through proactive measures. The cornerstone of IRR prevention is the use of premedications. These are medications administered prior to the infusion with the goal of dampening the immune system's response and minimizing the risk of reaction. Think of them as a calming influence, whispering, whoa, 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 easy does it, to the overzealous guard dog we discussed earlier. The specific premedications we can use can vary depending on the type of cancer treatment being given. Each drug has its own unique profile and associated risk of IRRs. It is always recommended to read the protocol or regimen for the drug to give the recommended premedications for the drugs involved. In lieu of specific guidance, each unit should have an infusion-related reaction policy to guide in the management and prevention of infusion-related reactions. I'll go through some commonly used premedications. These include antihistamines. So these medications, such as diphenhydramine or chlorphenamine, work by blocking the action of a histamine, a chemical which is released by the immune system during allergic reactions. Think of them as a soothing balm for the immune system, reducing itching, swelling, and other allergy-like symptoms. Corticosteroids, these powerful anti-inflammatory drugs like dexamethasone or prednisolone or hydrocortisone, suppress the immune system response more broadly. They're like turning down the volume on the entire immune orchestra, reducing the likelihood of a cytokine storm. And pain and fever reducers. So medications like paracetamol or ibuprofen can help manage fever, chills, and muscle aches that sometimes accompany IRRs. While not directly targeting the immune response, make the patient more comfortable and alleviate some of the distress associated with the reaction. It's important to remember that pre-medication is not a one-size-fits-all approach. Patients receiving high-risk treatments might require a more intensive regimen than those on lower-risk therapies. Additionally, patients with a history of allergies or previous IRRs might need additional precautions. But as we all know, even the best laid plans can go awry. Despite our preventative efforts, some patients will still experience IRRs. This is where prompt and effective intervention becomes paramount. The key is to be prepared and to have a clear plan of action in place. If a patient develops a mild reaction, such as a localized rash or mild fever, the infusion is typically paused or slowed down. We can then administer medications such as antihistamine or corticosteroids to alleviate symptoms. Close monitoring is essential to ensure that the reaction doesn't worsen. For more severe reactions, the infusion is stopped immediately and additional medical personnel are called in to assist. The patient might require oxygen therapy, IV fluids, or other interventions to stabilize their condition. This is where having an IRR kit, or sometimes known as a hypersensitivity kit, readily available becomes invaluable. An IRR kit is essentially a toolbox containing medications and supplies needed to manage a reaction. It typically includes intravenous antihistamines. These can be given rapidly to counteract the effects of histamine release. Intravenous corticosteroids. These provide a stronger anti-inflammatory effect than oral medications. And emergency medications. In severe cases, medications like adrenaline might be needed to reverse anaphylaxis or other life-threatening complications. Having a well-stocked and easily accessible IRR kit can mean the difference between a swift resolution and a prolonged or even life-threatening reaction. It's a testament to the importance of preparation and teamwork in managing these unpredictable effects. Remember, managing IRRs is a collaborative effort. By working together, being prepared, and understanding the available tools and strategies, we can ensure that our patients receive the best possible care, even in the face of unexpected immune reactions. So I'll do a quick wrap up here, and I'll bring it together with some maybe real life scenarios. So I'll do two scenarios. So to truly understand the significance of infusion-related actions and the importance of our preparedness, let's step into the shoes of healthcare professionals on the front lines of cancer care. So we'll do scenario one, a mild infusion-related reaction. So imagine Sarah, a young woman recently diagnosed with lymphoma, is receiving her first dose of rituximab, a monoclonal antibody. About halfway through the infusion, she starts to feel a bit itchy and flushed, and the nurse notices her heart rate is slightly elevated. These are classic signs of a mild IRR, likely grade 1 or 2 on the CTCAE scale. The nurse promptly pauses the infusion, alerts the doctor and pharmacist, and checks Sarah's vital signs more frequently. The doctor orders an oral antihistamine, which Sarah takes readily. Within a short time, the itching subsides. Her temperature returns to normal and her blood pressure stabilizes. After a brief observation period, the infusion is resumed at a slower rate. as they are complete of treatment without further incident. This scenario highlights the importance of early recognition and prompt intervention in managing mild IRRs. With quick action and appropriate medication, we can often prevent these reactions from escalating and ensure that patients receive their full course of treatment. So in scenario 2, a severe IRR, now let's consider John, a middle-aged man with metastatic colorectal cancer, who is receiving his first infusion of cetuximab, another monoclonal antibody known to carry a risk of IRRs. Within minutes of starting the infusion, John complains of feeling dizzy and short of breath. His blood pressure plummets and he develops a widespread rash. This is a rapidly evolving severe IRR, a grade 3 or even grade 4 emergency. The nurse immediately stops the infusion, activates the emergency response system and calls for the IRR kit. We rush to the patient's side, administering intravenous antihistamines, corticosteroids and fluids. We also provide oxygen therapy to support his breathing. Thanks to the quick actions of the healthcare team, John's condition stabilizes, but he requires close monitoring in the intensive care unit for the next 24 hours. This scenario underscores the critical importance of preparedness and teamwork in managing severe IRRs. Having a well-stocked IRR kit readily available and a clear protocol for emergency response can be truly life-saving. So as these scenarios illustrate, IRRs are not just minor inconveniences. They can significantly impact a patient's experience of cancer treatment. Severe reactions can be frightening and even traumatic, leading to anxiety, treatment delays, and in some cases, a reluctance to continue therapy. By understanding the nuances of IRRs, their causes, risk factors, grading, and management strategies, we can minimize these negative impacts. We can educate patients about what to expect, reassure them that we're prepared to handle any reactions that may occur, and empower them to be active participants in their care. Remember, IRRs are complex and can vary widely in their presentation. The CTCAE grading system is a valuable tool for assessing severity and guiding response. Prevention is key, but preparedness for intervention is equally important. Teamwork, communication, and clear protocols are essential for optimal management. And a final message, and maybe a bit of homework for you guys, is read your own hospital's infusion-related reaction protocol or policy and be aware of the steps to effectively manage and prevent infusion-related reactions. Thanks for joining me on this episode of covering infusion-related reactions. As you might hear, I have a little bit of a cold, so a bit of a struggle to get through this podcast, but I hope that this podcast has shed light on this important aspect of cancer care and equipped you with some piece of knowledge and confidence to provide the best possible care for those patients who might experience an infusion-related reaction. As always, thank you so much for anybody who has left some feedback for me in feedback form. This podcast will also be available from feedback that is provided as a video series on YouTube, as some people have said that they like to consume education content through YouTube. So it will be put up as that and on my LinkedIn as well. So as always, we'll end this podcast with the important disclaimer. This podcast is for educational purposes only. Remember, the field of cancer care is always advancing and new research may lead to changes in treatment approaches or protocols. Always consult your team for personalized guidance and discuss any information from this podcast with them. Seek information from trusted local and national resources for the most up-to-date recommendations. Thanks, guys. See you next week.